That is the first video I'm going to show you. It's a great example of how someone looks when they're actively dying. You can see she is fully unconscious. Her mouth is open like that because the muscles it takes to close your mouth and hold it shut are relaxed. So people's mouths at the end of life will almost always be open. Her eyes are closed. You can't tell because they're blurred, but her eyes are closed, but sometimes even their eyes will be open, but they're not really there. It's also very normal for that to happen, and that's also because of muscles relaxing. Her family is keeping her comfortable. I love seeing this part because they're using that sponge, which usually has some kind of cold water or juice or something on it, to moisten the mouth. You can even put it inside your loved one's mouth to moisten their tongue. Just keep everything moist in there. They don't need to swallow it or drink it. It's just a matter of keeping everything moist. Now, what was that gurgling noise? That's the worst part. People hate it. It's called a death rattle, which I think is an awful name, but that's what we're working with. And it sounds worse than it is. At the end of life, your body is still creating moisture to keep your mouth moist. Just like you and I, it's happening to us unconsciously right now, and we will unconsciously swallow that saliva. I just did it right now. At the end of life, the saliva is being created, but the body is no longer telling itself to swallow. So it's just sitting there on the back of their tongue, and with each breath going over that saliva and their mouth being open, it's creating a gurgling noise. People really don't like it. They think their loved one's drowning on fluids. That is not happening. Some people's death rattle will be worse than others. It just depends. There are many things you can do to help with that. One, you can just let it be because it's okay. Two, you can sit them up like they sat her up. You can use sponges to try to get rid of it if you want. You can turn your loved one on their side to help it come out of their mouth. You can give medications to help dry up those secretions. All of this can be offered to you by your hospice company as well. You guys know I love the Macy catheter. So today with the Macy catheter, what I want to talk to you about is sublingual medications and when the Macy catheter will be helpful. So a lot of patients on hospice will be getting sublingual medication, which means bits of medication placed under their tongue or near their gums so that medication can be absorbed in their mouth, which is very effective most of the time. Sometimes what happens is when someone needs too much sublingual medication, it takes too long to be absorbed, so a lot of sublingual medication can be stuck in that person's mouth. Plus, add on the terminal secretions, the medication can almost make that worse. So in this case, the Macy catheter would be a great alternative. So for those of you who don't know, the Macy catheter is placed rectally, and then this part of the catheter is placed on the thigh where you can give medications to your loved one, or the nurse can give medications through here. And you know I'm a big fan of rectal medications. People always are turned off or taken back by the rectal administration of medications, but truly the rectum is super vascular and it absorbs medications really easily, really well, and it's super effective. So a lot of people would associate this with less dignity, but really once it's placed, this is where the port lies on the thigh, and you can give medication so easily and it's so effective, and you don't have to worry about too much sublingual medication not being absorbed in your loved one's mouth. So a great example of when to use this is when someone's having a lot of pain or a lot of agitation and the sublingual medication is just too much or not cutting it. The Macy catheter is a great alternative to give medications like that, one, for effectiveness, and two, to avoid all of that sublingual medication not getting absorbed. To learn more about the Macy catheter, visit the link in the description. This next video is of the same woman.